Can you drink alcohol when you're breastfeeding?
You can. Your breast milk is constantly filtering. So if I have a glass of alcohol now and breastfed like within 20 minutes, that the baby is going to get that alcohol. That time can be different for different people. And this is what I tell my patients and clients. If they're planning on drinking alcohol, nurse your baby or pump before you have your drink or two. And if you're feeling drunk, your breast milk is also going to have that alcohol in it. So once your body has filtered out the alcohol, then it's a good time that you can go back and feed your baby. Welcome to The Unplanned Parent. I'm Dr. Angelica Rampal. My patients call me Dr. Angel. Today I'm here with my favorite babysitter and my kid's favorite uncle, the gregarious Raman Rampal, talking again about his journey to becoming a father with his longtime platonic friend, Ashley. Today's episode's all about the kinds of questions my brother should be thinking about as he gets ready for his son to arrive in the springtime. As usual, I'll be sharing the physician's perspective to help those of you who feel unplanned in some parts of the parenting journey become a little more informed. We'll start with Raman's story, then share our favorite recurring segments about what's normal and not normal, and hopefully tell you a few things you just didn't know yet. Welcome to today's episode of The Unplanned Parent.
Well, I'm really glad we're doing this episode today, Angel, because so far I have been thinking about one or two questions that have been on my mind. One question is where am I going to live? And I need to get a place in San Diego at some point. So you should probably tell me all the more important stuff I should be worrying about.
That's a great point. I think most people going into parenthood are already living in the same area. Not always, but figuring out the living situation is something you should probably do. But let's we can save that for offline. I've got a couple questions for you today. So first of all, you're having a boy, and I was just wondering, have you guys talked about circumcising?
No, we have not talked about circumcision. We've talked about a few things that has not come up. And, I actually don't have too many thoughts of what that emotes. The first thing I think of is Boko Haram, in Africa. And there was all this news pieces about female circumcision, which I think and know is pretty different. But that's the first thing that comes.
Yes.
Yeah, that's the first thing that comes to my mind when I hear that word. And so I think of like genital mutilation, and I think of diseases. And I don't know too much more outside of that as to like what is the general practice, what should be done, what's best for the kid. And so if you could shed some light on that, that'd be cool.
So that's interesting that you brought up diseases. So first of all, yes, female circumcision is very different than male circumcision. We don't usually do female circumcision in the United States. We do tend to refer to that as genital mutilation. So we're just going to not talk about that too much. But male circumcision is very common in the U.S. The American Academy of Pediatrics is in favor of circumcision. But if you look at some European academies that are of equal caliber, they are not as much in favor of circumcision. So I have my thoughts on that. But the European academies actually kind of accuse the American Academy of Pediatrics of looking at the data from a biased perspective, because it is very cultural to want to circumcise. So the reasons to circumcise are because if you want the baby to look like dad and dad was circumcised, if culturally that is part of your community's practice or your religious practice. And then there is in certain groups, it can reduce the risk of diseases. Now, for UTI and common infections like that, there is a reduced risk, but the diseases I'm talking about is more like HIV. So in the United States, where we don't have high rates of HIV, whether you want to circumcise your kid to have the slightly reduced risk of an already uncommon occurrence of urinary tract infection, you can kind of take it or leave it. So the advice that I usually give parents is you make the decision on your own. There is some data that it can reduce your risk of infections, but mostly that's in high-risk communities. And the more common infections that you would prevent are urinary tract infections, which are pretty rare anyways. But certainly I don't prevent parents from circumcising. I'm kind of, but it is something that you need to talk about with Ashley. Probably before the baby comes, because usually babies are circumcised within the first week of life. So it's not something you want to be arguing about right
Is
when.
is there a thought process where, hey, why don't we let the kid decide when he's 10 years old or 15, and
Yeah.
why
So,
not, yeah, why not make this decision, leave it up to the kid?
yeah, a lot of people feel that way because uh there is skin there that has feeling, and kids there is a subset of kids who are upset, and there is a subset of the population who feels that it is genital mutilation to cut off a baby's foreskin. So that is what circumcision is. So if you can see my finger, my finger is the shaft of the penis. There's skin that is like kind of like a banana peel that's at the top,
This is all
and
very
what you do
uncomfortable
is
for me, by the way.
yeah. There's some foreskin at the top, so at the top of the peel of the banana, and you just like cut that off so that you can see the head of the banana kind of sticking out a little bit more. And uh why but that skin that is at the top does have sensation, and so some people feel like you are taking away this skin that would feel good for this kid and maybe let them decide as they get older. It's just that when they're younger, it's a lot easier. You do it under local anesthesia, and you basically inject a little bit of lidocaine at the base of the penis and then pull the foreskin up and clip it off. The risks are very minimal. In my 20 plus years, I've never seen an infection. And, and with older kids, the risk of infection is also going to be minimal, but you are generally at that point putting them under general anesthesia. So do people do it? Yes. Like people that do have some complications. So I should mention, there are some other rare complications in uncircumcised kids, like the foreskin can get trapped, and there are some things that or they can have recurrent infections. So there are some reasons why kids do get circumcised older in life, like 15, 16, 18, or some kids just want to, they prefer to, because they don't like being uncircumcised for just social reasons.
If I could ask you a question, do you know if the rates of circumcision then are higher in the US than they are in Europe or other parts of the world based off of the pediatric community?
Yes, rates of circumcision are higher. And that is another reason why I think I just wonder, sometimes when big medical groups have consensus statements, it's to help guide insurance companies. And so if the American Academy of Pediatrics says that we don't need to circumcise babies, then insurance companies don't have to cover circumcisions. And if that's not in line with how Americans want to be with their babies, then that causes there's a little discrepancy there. So I do wonder, just as an independent thinker, I wonder what kind of pressure was on the American Academy of Pediatrics. I don't want to go too much into them. I'm really in line with most everything they say, but I do wonder sometimes what the motivation was to come out against circumcision.
Maybe we can follow up with that later, because I certainly love talking about circumcision. I'm sure you do too. You want to go on to the next topic I might want to be thinking about?
Yeah. So are you guys planning on breastfeeding? And have you talked about?
I'm not going to breastfeed, but maybe Ashley will. So dad can make dad jokes. Come on.
Is it important to you though? Because what if it doesn't work out?
So from what you have told me in the past and what I have been told is it's good for babies' immune systems, mental
Bonding.
bonding with the mother, and it's good for just like neuronal growth, brain development, right? That's what I've been told. I don't know if that's actually the case, and I'm under the assumption that there are millions, if not billions, of children that have never breastfed who are intelligent and great and healthy. So yeah, that's pretty much all I know on that. But yeah, we did talk about it, and we both agreed that if she can do it, she should do it.
Yeah. So I would agree with that. I think that breastfeeding has a lot of benefits. It can reduce risk of allergies. It can help the microbiome develop, which in turn helps the immune system develop. It's good for brain development. I also agree that it doesn't work for everyone. And I think having the discussion beforehand so that a parent, usually the mom, does not have an epic breakdown or feeling a failure. Uh, it's I've witnessed it so many times. Breastfeeding is really hard, and it's not the end of the world if you are unable to breastfeed your baby, and or if you just choose not to because it's too stressful, because maternal parental stress also affects the baby's growth and development. And so having a crazy stressed out parent is not good for the baby, even if it means you're getting some breast milk, and you're not going to get breast milk if you're really stressed out. So it's all cyclical. I was not breastfed, and I always tell parents that I love it if it works, but we can work on things and find other ways for you to nourish your baby. And I mean, nourish your baby not just with food, but with love. And all those things make a difference in how your baby's DNA unfolds and how the baby's, I think of your DNA as, it's like your scaffolding of your house, let's say, or the building of your house, but then you have window dressing, and that is the ways that your windows are dressed. All of that kind of unfolds in the baby's life based on the exposures. So breast milk is one of those exposures, but love, caring, environment, the food that you're eventually going to eat, all of those are things that affect the baby's genetic window dressing. So, but I do think it's important to just be ready for that. Like, breastfeeding might not work out, and there's.
If I can interject real quick, you said it's stressful and difficult. Shouldn't this be like the easiest thing that a mother could ever do? Millions of years of evolution. I don't feel like that giraffe out there is stressed out breastfeeding its newborn baby.
Yeah, that's a fantastic question. And I remember years ago that I think it might have been the San Diego Zoo. There was some sort of primate in captivity, and the primate had a baby, and the primate didn't put the baby to the breast. They couldn't feed the baby. The baby died. Then they showed it a video of primates that let's call it a chimpanzee, I can't remember, in the wild breastfeeding their babies, and then it was able to breastfeed. It learned.
So you're saying I should watch breastfeeding movies with Ashley?
What I'm saying is that breastfeeding is very social, and we as a community are not that social about it. Like, when was the last time you just saw mom openly breastfeeding? We hide it. We hide it behind hooter hiders. We hide it in nursing rooms at the airport. We don't do it as a community. And also, I think, to your point that, like, we've been doing it for a long time. One, in a lot of cultures, that's why we have wet nurses, or people share. Like, a sister might breastfeed her sister's baby if that sister didn't make milk. It was just kind of common that we would help out. So now we have things like donor banks where you can get someone else's breast milk to feed your baby. It's, kind of mimicking that, but it's the modern days version. It's not as social, and it's not as easy, and it's quite expensive. But sometimes in certain situations, like in the neonatal ICUs, you can ask for it. And if, like, your milk hasn't come in, or your baby needs to be in ICU for a few days and mom's not in a position. So I think it's important for parents to know that donor milk banking is an option, but then also that formulas are out there, and you can work with your doctor about formula to figure out which formula is a good option for your baby. Most importantly, though, I would say have a lactation consultant lined up. And if you haven't picked a pediatrician, pick an office that offers lactation consulting services. You can also ask your hospital whether they have lactation consultants, and most of them do nowadays. But that's really it's just so important, because we don't have, like, the natural organic community anymore. So we rely on our nurses and lactation consultants, and sometimes pediatricians, to help us. I certainly relied on my lactation consultants because I did not learn about this kind of stuff in medical school. And I don't think most doctors learn a ton, even if they learn some. So that would be my advice to you and Ashley on that.
Okay, and you know what I think people would find pretty fascinating, and myself and Ashley, is so once the baby's born, can we go celebrate with a glass of champagne?
Can you drink when? So first, yes, you can. But I would say Ashley will be so tired, she might just fall right asleep.
Let me rephrase. Can you drink alcohol when you're breastfeeding?
Great question. And you can. Your breast milk is constantly filtering. So if you drink if I have a glass of alcohol now and breastfed like within 20 minutes, that the baby is going to get that alcohol. That time can be different for different people. So what I would say is if you are planning on drinking, and this is what I tell my patients and clients, if they're planning on drinking alcohol, nurse your baby or pump before you have your drink or two. And if you're feeling drunk, then your breast milk is also going to have that alcohol in it. So once your body has filtered out the alcohol, then it's a good time that you can go back and feed your baby.
Sounds like a lot to keep track of.
Not really. So like if you're going to nurse at 5:00, nurse your baby at 5:00. And then if you want to have a glass of wine, have your glass of wine, because you're going to nurse again in like 2 hours. And hopefully by then that wine is out of your system. I would say that's the healthiest thing to do if you are planning on drinking. And in a lot of cultures, and my lactation consultants used to do this, they used to recommend having a glass of wine or a Guinness because there's something in Guinness that helps that helps with milk let down. And wine also can have these relaxation effects that can sometimes help with milk let down. It's not a horrible thing to have a glass of alcohol, but if you're going to drink more than that, it's probably not safe. So have a drink, maybe have two, but don't overdo it, because then that's not going to be good for your baby.
All right. Well, what's next up?
Okay. So I remember when I was in the OB offices, there were a lot of brochures around, and I was overwhelmed. And one of them was about banking cord blood. Have you guys talked about cord blood banking? Do you know what it is?
Ashley actually briefly mentioned it to me, and my first question to her was, will this benefit me or you? By me or you, I meant me or Ashley. Like, could we use the baby's cord blood to one day fix a problem we're going to have when we're older? Then my next question was, could the baby's cord blood be beneficial to, obviously, the baby itself and to your children, Angel? So those were my questions, and I did not get to answers on it, but that's kind of the first thing I thought of.
Okay, yeah. So the most likely person that a baby's cord blood would benefit is a baby's sibling. So first, let's just talk about what cord blood banking is. So when people hear about a stem cell transplant, that is usually, we're talking about cord blood transplant. So that is blood that is taken from the umbilical cord after the baby's born, and it's stored somewhere, and it's kept at a certain temperature, and it's stored indefinitely. And you pay a fee somewhere, usually like a few $100s a year. So it's not cheap. And people do this kind of as a very expensive insurance policy for just in case something goes wrong with their baby. What most people don't know is that cord blood is rarely going to be used for the baby, because let's say, don't wish this on anyone, but let's say the baby has leukemia. If that baby needs a bone marrow transplant or a stem cell transplant, you're not going to give it from its own blood, because we know it's unlikely we're going to take it from its own blood, because we know that something already went wrong in that baby's blood, which led to the leukemia. But if it's if the baby's sibling has leukemia, then it's very likely that the sibling's cord blood might be a good match for sibling B. So let me make that clearer. If sibling B has a disease that would be responsive to a cord blood stem cell transplant, sibling A's cord blood might be helpful. But if sibling A has a disease that needs a stem cell transplant, it's unlikely we would use sibling A's own blood for that, because that blood has already proven to have some sort of problem that led to the leukemia in the first place. So there are some rare conditions where you might use your own stem cells, but really you're more likely to be benefiting your sibling if you store your stem cells. So if you're storing your baby's stem cells, unless you're planning on having future babies, which you guys might, you have somewhat 8 or 9 other embryos. So that's the decision you have to make. Are you going to store this for a potential future baby? And I think parents need to think about that when they're deciding to store their baby's cord blood, that they need to know that it's not for that baby, but it's for siblings, potentially in really, really rare situations. The other thing is that many hospitals offer public banking systems, and I do think that's a better option, because then your baby's cord blood goes into a public bank where they're more likely to where the blood is more likely to benefit somebody else.
So how much likelier is it to have a match with a sibling for cord blood? I don't know if that's the right word to use, match, than just getting it from, one of the other millions of banked cord bloods that could be out there.
I think the chances is much higher. I don't know that off the top of my head. So we would have to bring on a hematologist probably, or I'd have to dig a little bit to get that number, but it is more likely to have a closer match with a sibling than.
And if you want to share, did you bank your kid's blood? And whether you did or didn't, would you do it again?
I banked 2 of my 3 kids' blood, because I figured now each kid has at least one sibling if they needed it for something. And at the time, I think you have to take into consideration whether this is financially something that is going to, I think you have to take into consideration whether this is something that is going to hurt you financially. So financially for us, it made sense to do it. It is not logical sense. And I was certainly preyed upon by the vultures who could smell my new mom fear, or
wow.
almost new mom
Harsh
fear.
Words.
That it is kind of like that when you're in those offices, because a lot of people are willing to spend a lot of money to keep their babies safe. But I do think those brochures never said that you're banking this blood to help potentially help a future sibling of this baby. It makes you just think of that very rare situation where you might be helping your baby.
So sounds like you're saying it might be a little gimmicky, but if money is no matter, you might as well do it, because who knows? And maybe who knows how science might progress down the road too, is what I kind of
I think that's it. So let me take you to another question. Do you know CPR?
I took a class for adult CPR like 15 years ago. Does that answer your question?
Yeah. No, yeah. So that means you probably don't know a lot of CPR, or you're not up to date with CPR. And what about infant CPR or toddler CPR?
I believe they did a little course on that too. So with the adults, I remember they said the second time I did the class, there was no more mouth to mouth, and it was just pumping. I don't know if that's true. And then with the infant, I think it was like a finger that you push in between the rib cage. But why don't you tell people what?
Yeah, no. And I don't want to go into it too much, but I do think, with infants for CPR, you might use fingers, or you might, we would need dolls and simulators, but you might wrap your arms around the baby's rib cage if the head is over there for people that are watching, and press down like this. But what I recommend is everyone take an infant CPR class, a regular CPR class too. That would be great before you have a baby. It's just important to know how to do that. It just gives you confidence. Chances of you having to do it for your own kid are pretty slim. But I also think it's really important for everyone to learn how to do the Heimlich maneuver, because toddlers tend to choke on things. I've had to Heimlich my own child. When my oldest was 3, she choked on a piece of cucumber sushi. The rice and the seaweed all got balled up in her throat, and she was standing there eating, and she didn't do this universal sign, but she stopped talking, and I was able to, because she was so small, I was able to do the back blow Heimlich on her, which is an infant Heimlich, where you hold the baby kind of in the palm of your hand. Their head is facing down, their belly, your hand is kind of here, like right under their chest, and you give really hard back blows. And her piece of sushi came Flying out. So it is important. I've had many parents tell me stories of how they Heimlicked their toddler. So you have some time. It's usually when babies are getting a little older and eating. So no need to do it right away, but something to put on your to-do list and definitely highlight.
Does Heimlich get taught at the same time CPR does?
Usually, yes, but if not, there are special Heimlich classes. So I was wondering about your thoughts on skin to skin time and whether you're planning on doing skin to skin time with your baby.
I think I did skin to skin time, at least for some time, with all your children, maybe. I think I have photos of it. It was beneficial to me. I felt nice. It was like this like warm little body that just like curled up on you.
Well, that's what it is basically, and you're doing that for the baby. And I think skin to skin is something that we always tell moms to do, and it's kind of recommended immediately after birth. And we, you're not really supposed to take the baby away for a lot of things like here we take the baby away for weighing the baby in baths and this and that, but you're really supposed to try to keep the baby as close to the mom as possible, on the mom for at least the first day, and then as much as possible afterward. And I recommend for dads too, for exactly what you just said, because it feels good. And so that feel good feeling is the release of our feel good molecules, including oxytocin, and the same thing's happening in the baby. Your heart rates are changing. The baby's what do we call it? The parasympathetic, which is your relaxation nervous system, is getting activated. So I'm glad that you did it with my kids, and I want to make sure that it's something that you've thought about doing with your kid.
I haven't thought about it, but I will do it. Oxytocin, that's the same chemical that gets released when my dog licks my face, right?
Probably.
It probably doesn't get released when your dog licks your face, though.
No. No.
Riddle me that.
I'm not as much a dog lover as you are. Before moving on to our medical breakdown, I want to just ask you one other question. There's so many questions to ask about whether you know how to change a diaper, do you know how to install a car seat, many other questions. But I'm going to ask you one last question. What are you most scared about?
Who? I think it's just a general kind of there's not a lot of textbooks or documentation about platonic co-parenting out there. So I think it's kind of like, all right, are we just kind of gonna write the rules on how this is gonna work? Especially, I'm in a relationship with someone, so it kind of, you know, it's another variable, and it's just kind of how is it all
Just to clarify, just to clarify, you are dating somebody.
I have a girlfriend who is not going to be the woman that is giving birth to my kid.
Yes. So you're platonically co-parenting with Ashley while maintaining this relationship with your girlfriend. And yes, there's probably not a lot of books on that.
So, I think a baby is going to take a lot of my time, even though I think Ashley has definitely committed herself to doing everything in the world she can, and she's going to get a very long maternity leave. That being said, I certainly think it's going to take my time too, for the welfare of Ashley and the baby. So I think how is it going to play out with juggling my time, I think is one thing that kind of I think about. And, I think the other fear is just kind of like, I just hope the kid's going to be healthy. And, that's really the most important thing. And then once you get over that hurdle, you can start worrying about, if the car seat's installed right and if my Heimlich maneuvering skills are okay. And
Yeah. Yeah. What are you most excited about?
I'm kind of excited to watch your kids interact with this new little guy. I think they're all very excited about it, and I'm kind of excited to see if they're going to be more of like an aunt or uncle figure to him, or if it's going to be more of like a sibling figure to him. I definitely think your eldest daughter Chaya is going to take on like a parental role. She's only 14, but she already takes on a parental role with me. So I So I think with this little guy, she's gonna be much more in that position, and I welcome it.
Oh, Yeah, well, yeah, we're all really excited about this baby coming. So, yeah, thank you for sharing all that. I will just share that I was most scared about losing sleep. Sleep is really important to me, and just that waking up every couple of hours to feed your baby was scary. The thought of it was scary, and when it happened, it was really scary. And um, I had postpartum depression with all three of my kids. I was not comfortable enough dealing with it with the first two. So I kind of powered through it, which was not great. By my third, didn't I had lost all capability of functioning well. And we'll talk about postpartum depression more at a later date, but I think losing sleep certainly contributed to my symptoms. And it's hard to talk about postpartum depression, but it's one of the things that we like to do here is talk about
Maybe
things
we
that
can make an
every
episode out of that. So you being like this, thanks for opening up about that. But you being like this expert on children, or as close as one could probably get, you know, what were you worried about with your first or second or third child? And well, let's say first. And what was your expectation of your husband, Tim? You knowing so much, was it kind of like, I'll take care of everything, you don't need to worry about anything? Or was it more like, you need to know everything I know now?
Yeah. Well, I my biggest concern was having a healthy baby. Like that was, it was like as long as the baby came out okay, that was what I was worried about. And even that, what does that mean? But I wanted to get to the end of the road, which meant a birth of a baby. And when it came to Tim, I made him take the parenting classes. I did not want to be the person that had to change all the diapers because I'm the pediatrician. I did not want to be the person that had to swaddle.
Did he need a class to change a diaper?
He did take, yes, I think he did. And I think he felt like it built his confidence. And I would, I don't know that I had set expectations. In retrospect, I probably should have talked it out with him a little bit more, but he stepped up. I mean, he was up with me in the middle of the night. I had to pump because nursing hurt a lot in the beginning, and he was up helping me pump every 2 or 3 hours. We would take some shifts. My mom helped us, our mom helped us so that we could both get like a 4 hour stretch while she watched the baby. So we had a village that was helping us. You were there for a lot of the times. And so I think having a second adult there is very, very helpful, especially, I mean, even to go to the bathroom, like you're afraid to leave your baby if no one else is home, and you're going to leave them in the bassinet and they're going to be fine, but it's nice to have someone else around. So I do think that's something you and Ashley are probably going to have to figure out.
Yeah, one item amongst many, 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 huh? So, you want to go on to our Is This Normal segment?
Yeah. Do you want to start with the medical breakdown first?
Sure, let's do that.
Yeah, we talked a little bit about most of these things already. But I'm just going to do a quick summary. In terms of banking cord blood, if you have a public cord bank option at your hospital, please find that out before you're delivering your baby so you can know whether that's an option. And then otherwise, I think if you're planning on having future babies, keeping in mind that banking a baby's cord blood is more likely to help a sibling than to help the actual baby whose cord blood is being banked. If financially that's something that makes sense for your family, then I would do it. But it is, as my old hematology colleague said to me, it is a very expensive insurance policy that you're probably never going to cash in. And then when it comes to skin, all I want you to take away is that it's not just for the mom. Skin to skin can help the baby and whatever adult loves the baby. So whether that means, having a dad hold the baby in the baby Bjorn, or the ergo with without a shirt on, which my husband used to do, and he's very hairy, but he used to walk around our neighborhood without a shirt on, and the baby would be on his chest.
Skin
And
to hair time.
it was I know it was skin to hair time for him. So but everybody
Equally effective.
so far yes, also worked. So I would encourage skin to skin time to be expanded to other loving adults in the baby's life outside of the mom. So I think we covered a lot of the medical breakdown in the earlier parts of the episode. So we can move on to the "Is this normal?" segment.
All right. So what are we talking about today? What is normal? What is normal, Angel, and what is not normal?
So I just want to say that not knowing everything is normal. Not knowing how to hold your baby, not knowing how to change a diaper. I always told parents during newborn visits that I have 3 kids. I've been a pediatrician for like 20 years, and I don't know how to swaddle a baby. I buy the ready-made swaddles. So you don't have to know everything. You just need to have the people that can help you and guide you, whether those are your doctors, your lactation consultants, your siblings, or your partners, your platonic co-parent, or your spouse, whatever it is. You are going to be learning, and there's a lot of learning that's going to come up. And no matter how many parenting classes you take or diaper changing classes, which I do recommend, most hospitals offer that. Your OB-GYN's office probably offers that. You can go to those classes, but there will be stuff you don't know, and that's okay. My son just gave me some grace the other day when I must have said something to him, and he just looked at me and he said, "That's okay, Mom. You've never had a 12-year-old boy before. You're still learning." And so give yourself some grace. This is the first time you're going to have a baby in whatever situation you find yourself in, and you'll figure it out.
And is there some stuff you didn't know you want to share with us?
There's always stuff.
Will I get a degree if I take a diaper changing class?
There's always stuff I didn't know. I mean, and just, we did take the diaper changing classes. There was still like blowouts that I couldn't explain.
Ooh.
So
is that a euphemism for like really gross poop?
Yes.
Oh,
yes.
God.
They can just woof, like you have to dodge them. Okay. So stuff that I think is fun facts that I used to tell parents during newborn visits, like my first exams on the babies when I was changing the diaper, that it's pretty normal for babies to have erections, and most parents don't know that that outside of the teenage years, the newborn period is the time when boys have the most erections. So when you're changing your baby's diaper and you see an erection, don't freak out. That is supposed to happen. And we don't totally know why, but that's just what happens. Other things that I think not everybody knows is about sleep safety. And we didn't talk so much about sleep today, except for that I was afraid of not getting enough of it. But I think one of the things that parents should plan for when they have a baby is having the baby in their room, but not in their bed. A lot of parents think that co-sleeping is what the baby wants because we do want that baby to feel us near them and have, we talk so much about skin to skin time and kangaroo care. So should we also have the baby sleeping with us? And I love the idea of that, but the reality of American bedrooms with really fluffy pillows and down comforters and soft mattresses, with that kind of sleep situation, it's not safe to have a baby in the bed with you. So do think about the baby's sleep location and having a bassinet next to the bed where you can easily get to your baby if you need to change a diaper or feed your baby in the middle of the night, but not accidentally have a pillow get on the baby or something like that.
So don't co-bed with the baby ever, basically.
Mm-hmm.
And should I be worried if my infant son does not have a boner?
No, that is also okay. If you don't see the erection when you're changing diapers, that is also okay.
Okay,
but
I won't call you or my doctor then.
Yes, yes. Yes. Um, and another thing that some people might not know is that circumcisions are actually quite controversial. I remember being at an American Academy of Pediatric conference in San Francisco, and there were protesters out there protesting circumcision because they thought it was tantamount to genital mutilation. So I think that it's important for families to have the discussion and then just decide what you want to do for your kid, because sometimes grandparents have really strong feelings about this, or cousins, and you don't need to share it with everybody, but you can. But it is something that some people take very seriously.
Maybe I'll go to a pro rally and an anti rally and then make my decision after that.
That's one way to do it. Something else that I think a lot of parents don't know, and I like to inform them at that newborn exam, is that baby girls can have kind of like mini periods, like menstruation, from the withdrawal of maternal hormones. So you might go to change your baby's diaper and there's blood there, and parents will freak out if they don't know that that's okay. So please know that, so that you're not super alarmed if you're having a baby girl. The other thing is that baby girls can have some breast milk. Their breast tissue can feel firm, like there's something under there, and you're not supposed to squeeze it, because if you squeeze it, you'll actually get breast milk coming out, which is very alarming for many parents, but not you, because you will be prepared and you will not squeeze those mounds on your baby's chest. With time, your baby girl's body will just resorb that milk and it will go away. And with time, the period, the blood coming from the baby's vaginal area will also stop. That's usually gone within a week. The breast tissue might take a little longer.
That's all for today's episode of The Unplanned Parent, even if we're just getting started on the questions I'm going to have. Thanks so much for tuning in today. And just like always, if you love the show, please rate it and review it wherever you listen. That will really help us connect with other parents who, like me, have something they need to figure out as unplanned or not totally planned parents.